Hello everyone. Today we are going to take the interview of Dr. Sneha Shashidharan, who is a physiotherapist. Hello ma'am. Good afternoon ma'am. We would like to know something about your profession. Will you spend an half an hour with us?
Sure.
First of all, can you explain about what is physiotherapy?
When doctors give life, physiotherapists make that life worth living. Mainly we treat with patients' balance, coordination, those who have problem in sitting, standing and walking. We first assess, identify the patient's problem, then we help in rehabilitation and it helps to restore the patient's affected body parts.
Okay, why did you opt to become a physiotherapist?
Okay, when I was studying in standard 12, my grandfather got a stroke attack post bypass surgery. So all his surgeons and other doctors had lost all the hope in him. Like he had become like a vegetable. All the doctors had lost hope in him. But they told to continue with the physiotherapy. So I have seen the physiotherapist working so hard on my grandfather. She used to give various exercises, electrotherapeutic modalities and all, and within 1 year my grandfather was able to walk with the help of stick. I was so impressed by seeing her treatment, who was totally bedridden, and after 1 year he was able to do his work independently with a support, but yeah, most of his work independently. I was very fascinated by seeing her giving treatment, and I was very impressed by her work. So I thought even I would like to become a physiotherapist so that I can help the needy people.
Okay, from which institution you have passed or which university you have passed?
Okay, I have passed out from Rajiv Gandhi University, which is in Karnataka.
So tell me about your working experience.
Okay, our first year was basics like anatomy, physiology and all, which is needed for knowing any case. And from second year, we started observing the patients, or rather how our seniors, interns and our staff used to treat our patient, how they used to interact with our patient, how they used to set the goal for treatment goal. We used to observe second year. We were not allowed to treat the patient. From third and final year, we started treating the patients alone, and it was a very nice experience. Then later on, after my internship, I joined a clinic and also joined a hospital, well-known hospital, where I gained a lot of experience, which is still useful for me.
Okay, you mainly work in an organization or you are always visiting patients?
No, after my internship, I joined in a clinic as an assistant physiotherapist. There I worked for 7 months. Later on, simultaneously, I also joined the hospital, Fortis Hospital, which is in Mulund, which is a multi-speciality hospital. There I could treat even the international patients and our patients. And that was a very good experience in Fortis, because in Fortis I understood physiotherapy is not an individual's work, wherein the teamwork was also involved. Like we used to make a team of physiotherapists, and we used to treat the patient by setting a goal. We used to take reviews, and that was really an awesome experience. Means just not treating, but teamwork is simultaneously very important for a physiotherapist. So it was a very good experience for me.
After your studies, you mainly working in an organization you are always being visiting?
No, I started working in a clinic. After my internship, I joined a clinic and worked as an assistant physiotherapist for 7 months. Simultaneously, I also joined in a hospital, Fortis Hospital in Mulund, which is a multi-speciality hospital. There I could treat both national and international patients. And there I understood physiotherapy is not an individual task. It is a teamwork in which we have to set our goal. So we used to take the patient and we used to discuss the cases. We used to set the goal, like what we have to attain, and we used to take feedback and all these things. And it was really a good work. Even I could see many cases, new cases, which I was not aware of, or rather only read in books. I could see practically in Fortis hospitals. So that was really a very good experience for me, which will always help me in my future.
Oh, you had tell about your university. Now explain about your study life.
Okay, I did my schooling from Modern English School in Dombivli. Then higher secondary I completed from Menon College, which is in Bhandu. Later on, I joined for physiotherapy course in Mangalore under Rajiv Gandhi University. During that span of life, it was a very good span of my life in my college. We had to give importance to both studies and extracurricular activities also. And in that span, most part I enjoyed was my camping in various rural parts where we used to give treatment to people. We used to interact with them and all. And we also had postings in old age homes for treating old people, and in special school where we used to play and give treatment to the children, and that was a very lovely part of my college life.
I think you enjoyed it a lot, your college life.
Obviously.
We know that you have a very busy schedule, but our viewers want to know that what you do in your leisure time.
Yeah, you are right. I have, like, even in leisure time I have some work, because not only we have to give treatment, but in our hospital we have to prepare for our case presentations, and also that will be helpful for our other colleagues. So I usually do my paper presentations and case presentation. I study for that in my leisure time. Apart from that, I enjoy reading a lot. I read a lot of books. Actually, I'm a bookworm. I love reading novels.
I had read in a magazine that there should be a proper understanding between patient and a doctor in physiotherapy. Can you explain the patient-doctor relationship in your profession?
Yeah, you're very right, Ashwati. There need to be a lot of understanding between a patient and the physiotherapist, because I believe an ideal physiotherapist is one who appreciates the cultural, social, psychological and social factors which influence their clients. Because physiotherapy doesn't last for 1 day or 2 days. It lasts for many months or even a year. So while planning your treatment, you need to include the patient, your patient family or relatives, or the person who take care of the patient, because you have to explain them like what are you going to achieve, what is your goal. You can't work alone in treating a patient, because you give certain exercises which has to be done in absence of you. So even the family should be knowing like what all exercise you have to do, how to deal a patient and all. So I think it is very important to have a patient and doctor relationship, very good patient and doctor relationship, and have good rapport with the relatives and the carers.
Doing right now, are you working or doing your further studies?
You can tell both, because I'm planning to do my masters in physiotherapy in Australia. So I need to do all my processing and all this year only, and this coming months. So before that I have to clear certain exams to be eligible for applying. So I have those exams this month. So I'm preparing for my exams also, and obviously you can't avoid your patients. So I'm seeing my patients also. So I see patient, and rest of the time I study.
Can you explain what type of treatment do you give in physiotherapy? I mean that you prescribe medicines or using any other techniques?
Yeah, we don't prescribe any medicine. We give other techniques like exercise therapy, electrotherapy, manual therapy and hydrotherapy for some patient for gaining the results.
As you know, we are new to these terms. Can you explain in brief about these terms?
Yeah, sure. See, our basic funda is like we give pain, but we reduce pain also. Because in exercise therapy, initially patient experiences pain, but later on they cope up and they do very well. In exercise therapy, we give like exercises for our patient for reducing the pain, for increasing the muscle strength and for fitness. And in electrotherapy, we give various machines, or rather you can tell modalities, various parts of the affected body to reduce pain. In manual therapy, we used various mobilization techniques for our joints and other bones to reduce pain. And in hydrotherapy, that we use in some patient, and that is not practiced in all hospitals, but it's also a good technique in which we give exercise in water. That is, we give treatment in pools and in water baths. Next is geriatric patient, that is a old age patient. Well, we all know that after 40 or 50 years of age we experience a joint pain because of arthritis, osteoporosis, etc. We have a treatment plan for all these types of patients also. And the fourth one is gynecologics and obstetrics patient. There are various gynecological conditions in which there are physiotherapy treatment to cure it. And in obstetrics, we give exercise to pregnant ladies at a certain time, like after some months. These exercises, if done regularly, it 100% it help the pregnant ladies to deliver baby smoothly, like they don't experience too much pain in during delivery time. And the last part is ICU, rather it's a very important part. Round the clock chest physiotherapy is needed for all the ICU patient to keep the unconscious patient breathing.
What is your contribution as a physiotherapist in various fields?
Yeah, sure. Physiotherapists are needed from general OPD to ICU. As in, like in orthopedic field, physiotherapists treat starting from a simple back pain, neck pain, joint pain to various fracture conditions, dislocation. Physiotherapy treatment is very essential. And even in various major orthopedic surgeries, there is a pre-surgical physiotherapy exercise and even post-surgical physiotherapy exercise which has to be followed by every patient. So, and in neurology, which also plays an important part of physiotherapy, as I've told you before, the major part of physiotherapy is rehabilitation, which works in neurological patients. Neurological patient means we have to treat both adults and children, because there are some conditions like cerebral palsy, etc., which is there in children, which we have to treat. And we have planned various protocol for our neurological patient for taking them to a normal life, or say near normal life. We normally make them independent so that they can do their functional activity.
What about the awareness of physiotherapy in India? Are people really aware of it?
Asha, the awareness of physiotherapy is very less in India compared to other countries like UK, US, Australia and all. People are not aware like what physiotherapists do to a patient. They don't know what is the work of physiotherapy or how important their work is for getting well in certain conditions. Because like people think physiotherapy means massage, but that is just a technique. It's not a physiotherapy. As now you also will be knowing what all the physiotherapists are doing in daily, like with the patients for attaining their goal. So I feel when you compare with the physiotherapists in other countries like UK, US and all, they are valued so much. People are so much aware of their work or what is their work, and I feel awareness is very less in India.
What advice you want to give to the students who are willing to take physiotherapy as their profession?
Yeah, it's a very good profession because a lot of physiotherapists are going to be needed in the future. As I've told you, in various hospitals like government in general, unlike hospitals, physiotherapists are also needed in gym for various fitness activities, in special school, that is school for handicapped children, for giving them treatment. In various industries, physiotherapists are needed because nowadays employers are getting back pain and all because of the bad posture in the company. So many hospitals recruit their own physiotherapists to sort out their employer's problem, and even in various leisure and sport activities. As you know, nowadays in all countries, in all the sports, they have their own physiotherapist for training their sportsmen, because physiotherapists are needed for the fitness training of the sportsmen.
Now you are told that the awareness of physiotherapy in India is less. Then those who are taking physiotherapy, will they succeed in this profession?
Yeah, obviously. I'm sure in few years people will be aware of physiotherapy. There will be a lot of opportunities for the upcoming physiotherapist.
Sure.
Thank you, ma'am, for updating us about this profession. We are very grateful that you spend your valuable time with us.
No, it was indeed my pleasure, and it was indeed a great opportunity. I could tell so many things about my profession. I'm very thankful to you also for that.
Can you want to give some advice to our students?
Well, all the best students for your future.